Sir, you have been handling this for quite almost now 4 months from the time onset of the lockdown or even prior to that. Bombay has been identifying the early cases much than the other parts of the country. What is the reaction or how do you handle? Do you professors take the responsibility of disclosing positivity to the family, or do the assistant professors or the residents handle the disclosure part of it? How do you handle the way of disclosing this information, sir? Because it looks like it is now worse than to tell someone who have HIV or someone to have you are diagnosed to have a cancer. People are so much stigmatized. How do you handle it safely, sir?
I'll put it in a perspective. It does not matter who actually breaks the news to the relative, provided the person who breaks the news to the relative is a sensible one. As it is said, you never know when few words can have an impact on life. So whoever is speaking to the relatives has to be extremely responsible and know how to go about breaking this news, whether it is COVID, HIV, death, or whatever it is. Now, communication per se, to me, can be verbal. When you are talking relative, you got to be very careful in listening to the relative when the questions are asked. The second thing is non-verbal, where when you are talking to the relative, watch the expressions of the relative, whether the relative is understanding what you are trying to say. So you basically have to tell in your own or her relative's language so that they can understand. The third is written, which is a consent form, which is a different, which I will not include. Now, what is to be communicated is the question that has to be answered. Number one is not only positivity, but the clinical condition of the patient. Now, I will divide here COVID positive patients into very serious patients who are on ventilatory support, serious patients on compulsory oxygen, moderate symptoms requiring oxygen but are very likely to recover, early symptoms but proved positive, and asymptomatic who are these are the gamut of patients who come to us. Each one of them will require a different set of presentation when you communicate with a relative. Like a patient on ventilatory support who is deteriorating or not improving, the patient has to be relative has to be made aware of what is going to happen to this patient with high chance of mortality. Basically, preparation in relative's mind is extremely important. It's very easy to communicate with a relative with a patient who is asymptomatic and has come positive, or with a very mild symptoms and has come positive, because these are the patients who are likely to recover without actually doctor's help. The problem occurs is the patients with moderate symptoms and severe symptoms on oxygen without ventilatory support. Now, these are the ones where relatives have to be really taken into confidence and kept in the loop, maybe on hourly, 2-hourly basis, or as the patient's condition is improving and deteriorating, and that is important. Now, these sort of things, guidelines are always dynamically changing on CDC, this, etc. But morbidity and mortality is priority. Let me tell you that there are some good and sinister signs in a patient which have to be told to the relative at all the time, and keeping the relative on the time. In these days, especially, I can tell you about Mumbai, where obviously there are lot many cases which come up, lot many cases which have high mortality. Mortality rate is also high. You have to be very careful, because there are relatives who are sitting outside and they are ready, especially if a patient is young, they are ready to actually destroy things. So you have to be very, very compassionate and talk to them. So I would say you got to be gentle to the relatives when you're talking to them. Do not aggravate any situation, because the other relatives who are surrounding also are actually worked up as far as their relatives are concerned. So the most important thing, communication, is hear what is not said by the relatives. So you got to look at the patient's relative's face all the time when you're talking, whether the relative is understanding, whether the relative is not understanding, because at the end of a long talk with a relative of the patient or the patient himself, one question is commonly asked: Doctor, are you sure that my patient will become all right? That's the sentence. which tells us that the relative has not understood anything that you are trying to tell, and you got to come back again and tell everything till he says, okay, now I have understood, my patient is likely to improve, or there are slim chances that my patient is likely to improve. This requires skill. Unfortunately, neither at undergraduate level nor at postgraduate level this is taught. This comes through what the head of the unit or head of the institute teaches during ward rounds and even during routine surgeries. So that is where the things are picked up. It is our responsibility with this pandemic to awaken to this situation and make it a habit that when you're talking to a relative, all the resident doctors, PGs, and assistants listen to the way you talk, because they are only going to imbibe the same things. Thank you very much.
Thank you, sir.